Welcome, and thanks very much for joining us for this deep dive into supporting people with long-term conditions to live well through creative health, where we'll hear about some of the exciting opportunities and challenges of work that is already being delivered and some of the plans under the Place Partnership programme. My name's Hebe, and I'm the Creative Director of Cartwheel Arts. We're a participatory arts charity based in Hayward in the borough of Rochdale that co-creates diverse opportunities with communities that enhance well-being and celebrate culture and heritage. 90% of our work takes place in areas that rank in the top 10% most deprived nationally. And we use a diverse range of creative art forms to meet people where they're at and creative opportunities to support health and well-being. Two of these programmes include our Zinda Dil, or Lively Heart, project, which supports women aged 50 plus, predominantly of South Asian heritage, to access creativity, and many of these women also experience long-term health conditions. And our Art and Soul group, which is primarily targeted at adults aged 19 plus who wish to access additional support with their mental health and well-being. But as we all know, our mental and physical health often don't exist in isolation, and they don't improve, deteriorate without kind of impacting on one another. So just thought I'd share a short anecdote of a man who joined our Art and Soul project a couple of years after being experiencing a major heart condition and being signed off from work, not able to work again. And when he came to us, he had a long experience of unemployment, really low morale. And through that kind of visual arts groups, he's been able to improve his confidence, reconnect with other people. And his work was exhibited at home in Manchester in 2023. And he said, seeing my work here makes me feel on top of the world. I'm delighted to introduce our panellists today, whose work focuses on how creativity can support people with long-term health conditions. And the Place Partnership project aims to respond to the high hospital admission rates for COPD, costing Greater Manchester £73 million a year. Creative activity, delivered in partnership with E&O Breathe, will be offered to individuals experiencing pulmonary conditions, and a range of training modules will be developed and delivered with creative health champions from across the city region, which will include senior health and creative leaders. The Live Well Make Art Network, which is coordinated by Cartwheel Arts, will continue to engage both health and arts practitioners working at the intersection of arts and health. And over the next 3 years, we will be delivering a series of deep dive training sessions, monthly online newsletters, and in-person networking events. I've got a few postcards here if you want to grab one at the end, or there's some on the sign-up desk. If you're not already connected with Live Well Make Art, do make sure you sign up, because I think lots of the opportunities through the Place Partnership project will be disseminated through the network. So, without further ado, it's my absolute delight to introduce Gaynor Butler, who's a Senior Project Manager at NHS Greater Manchester.
Thanks very much, Hebe. So, hi everybody. So I work across Greater Manchester, part of NHS GM in respiratory health. And as part of our work, we look after the pulmonary rehabilitation services, so PR for short, we like an acronym. So our PR services are available across all of the 10 localities in Greater Manchester. However, there are some inequity in relation to waiting times and that kind of thing, and that's for various reasons. So we know that Greater Manchester in particular has the highest mortality rate from respiratory disease that's in the country, and I'm sure it won't surprise you that that is actually worse in areas that are more deprived, of which we have some of the most deprived areas in the country within Greater Manchester. So it's a very big challenge for us. So the pulmonary rehab programme is a 6-week education and exercise programme that is available free of charge for patients who have had a diagnosis of COPD, which is chronic obstructive pulmonary disease. So this is a life-limiting condition. There is no cure. And what the course for PR is aimed to do is to empower the patients to manage the condition better and to live better with the disease by a series of exercise classes and also education sessions. So what we're looking to do is educate the patients to better look after themselves with the condition and hopefully prevent any emergency admissions and that kind of thing that can happen when you've got this condition. And it's probably worth noting that a lot of patients with COPD have other conditions as well. So the PR programme is normally delivered by physiotherapists and their sort of assistants. And as I said, there is a very high waiting list in some areas of Greater Manchester, which is not great. So I guess what we're looking to do in partnership with ENO is to expand on their long COVID Breathe Better programme that was very, very successful, and try to offer that, to write the programme and pilot and offer it out to patients with COPD. What I suppose the longer term aims are to ensure that the programme is available across Greater Manchester for everybody. So we've got that equity of access. But for me, it's also about giving the patients choice about which rehab might be better for them with their condition. We know that when patients are told of PR services, they think, because they hear the word exercise, quite often a lot of them are switched off. So for me, it's about having that a suite of offers that might suit the patients and delivering that as close to home as possible. And what we're hoping the ENO will do is give us that extra opportunity to grow the programme and spread it out across Greater Manchester.
Thanks. Sounds really exciting. And we'll move on to Cassie Lee next, who's the Creative Health Research Fellow at Imperial College Healthcare NHS and is also working with ENO Breathe.
Thanks. Can you hear me okay? Yep. So just to say, I'm probably more familiar actually in the pulmonary rehab setting. That's my background. I am as a physiotherapist who's branched out and moved over into the creative health world. So I've come to you today to talk a bit about the opportunities and perhaps some of the challenges of what that might look like, making that, particularly that transition. I think the first thing to say is that we're in a great climate. This is the climate for change, for the National Health Agendas, the Creative Health Review, the DARS Review. People are looking, that's a range of people are looking to see what else can we do differently to tackle the state of the nation. So first of all, yes, there is an opportunity, but turning that opportunity into reality is, I think, the big challenge. So I think we do have a couple of slides. It doesn't matter if they come up or not. It's just to keep me on track, really. If anything else, it's just keep me on my comfort place. That's the wrong one. That's yours. I'll leave that one for you. If it comes on, it does. If it doesn't, it doesn't. So just to say about the opportunity, when I was thinking about the opportunity that we have in Breathe at the moment, I sort of looked back to say, how does opportunity come about in the first place? And I was talking to those who actually developed the program, who created it, to say, well, how did that spark get from concept to reality? And I learned only recently that apparently the opportunity came from, it was during the pandemic that obviously lots of people with creative health background and the arts were not in their normal roles, and someone decided to make some interesting clothing for the PPE and the scrubs, and send it around to hospitals to bring a bit of hope, cheer and joy in quite a difficult time. And some of the consultants at Imperial really embraced this and thought, wow, that's fantastic. What else can we do with this collaboration? And they decided to take that forward. And I think that's the point I wanted to just move on to 2 more slides. Is it going to appear? I've done the first boring one. Is it going to move? It'll catch up with me eventually. No. There's all your fears coming true all at once. So the innovative collaboration came about from a few unique individuals who decided to grab something and in a moment of darkness try to find a bit of light. And I think it was that quite unique partnership and having the people to embrace something new, people who were used to working in a world of healthcare settings in intensive care or on the wards, to think, how can we do something differently? There was a time and a space and an energy for that, and I think that's quite a rare opportunity. By no means are we saying we need another pandemic, absolutely not. But it's about how do we find those pockets of hope and energy to take these opportunities forward. The content development, so Susie's sitting here, can shed more light on that later on, everybody wants to know. But when I was hearing about the stories of how it was developed, it was a true collaboration. It was truly come from the arts and the health coming together. And it was a unique space in that everybody had expertise, but nobody was the expert. And there was that shared value of actually listening to each other. And thinking of how we can connect, not just with each other, but one thing that I think you guys do very well in this creative health space is actually connect with people. So delivering programs that aren't only embedded in academic science, but actually how to connect with people and engage with people and take that step further and out to reach people. And the timing, again, the rollout and engagement was key. Services were being developed and looking for support and for help for managing people with long COVID with breathlessness. And there was an offering. So it was a really timely engagement for healthcare services and also for people living with the condition to say, yes, I want help and support. If we only could just bottle that all up and just roll it out when we need it, that would be fantastic, but it's not quite as easy as that. I've tried to think about what do I think are the key bits that really made this grow and flourish. So where are the opportunities that we need to really grasp? And I think it's that shared value, purpose, need and trust. We need to get that when we work with our colleagues across. You know, I'm a physiotherapist. This is a very new environment, very new space. When we need to kind of come together to figure out how we work on those long-term condition pathways together. Recognise the experts in the room, so the expertise in the room, not just who comes with which salary or which hat. And I think that's a challenge. I think one thing that really made this programme a success was the acceptability and endorsement from others. So, you know, the first programme had the doctors actually come along to it and say, you know, sell it and believe in it to advise others to come along and having the evidence. I think that really helped. We say there is lots of evidence, but what evidence? What measure, what outcome, who are we speaking to for what purpose? If we want this to be funded and rolled out at bigger scale, I think we need to think about that level of endorsement so we can have the reach and accessibility that it's needed. And then the last one, I don't want to finish on the challenges because I'm hoping that the challenges will actually turn into positives. But it is a busy, crowded space within the healthcare service. Whilst we know we need to do something new, how do we actually come to the table to have those conversations? This space is great, but it's having the right people there. When there's often predefined pathways, and we've got this at the moment, you know, within working with the doctors and the nurses in clinics, to be able to say this is something new offering. Where does it fit within the current pathways of care? How do we actually get it there? How do we get the engagement and the inclusivity? Currently, this is an online program, so what do we need to do to change or how to reach out wider? And then particularly around the sustainability and future funding. Great to have this great program, but we need to adapt and evolve, keep moving it forward, one in long COVID, as that landscape's changing, but also within the long-term conditions in respiratory care.
Thank you. Thanks very much. And next we'll hear from Charlotte Leon-Hardson, who is the Social Prescribing and Workforce Lead at NHS-GM.
Yeah, hi. Good afternoon, everybody. And I apologise. Julie gave me a huge brief to talk to around in 5 minutes, so we'll see whether that's doable. If we could just get the slide up with creating healthier lives. And I do hope I do better than I did as a microphone runner, because that wasn't very successful. So medical treatment is not enough, and that saddens me as a previous nurse in my old life. That's not to say it's not good enough, but it's not enough. We need to support people to be able to access options and activities that they actually want to do, and not something they have to do, because if we have to do it, then we're not very likely to continue to do it to get long-term better outcomes. And Gaynor, you touched on it a bit before. Not everybody want to do a rehab program. Not everybody want to go to a gym on a GP referral exercise program, because they could imagine nothing worse than shifting weights or running on a treadmill, or it's so intimidating because they're all looking so wonderful and slim and strong and all this. So some might like to really dance, or they might want to sing or go in the forest and take photographies, etc., etc. But even if we could actually do the things that we really want to do, sometimes things get in the way. And for a lot of the people where we see poor outcomes or a lot of health inequalities, there are a lot of things that get in the way. Things like, money, putting food on the table, it's poor housing conditions, it's getting around, getting transport, paying for transport, or confidence to go on a bus. Low confidence in general to actually engage with other people and not just stay at home and being lonely. All those things create the barriers to staying, to having a healthy and happy life. So this is where social prescribing comes in. So in social prescribing, the person is in focus. What matters to them is in focus. What they want to achieve is what matters. That is where what the conversations are around. And the link worker is somebody who truly listens to that and try and support that person to access the things that they feel would improve their life. And alongside that, they support the person to build confidence and build motivation to support self-management. And self-management is where we want to go, where people take that ownership and are able to do that. So we need to enable clinicians, non-clinical roles, and our communities to work together much more to on the ground, making sure that these opportunities are available. We don't have to wait for the whole system at the top to create that environment. We can start ourselves by reaching out on neighbourhood levels. It's to have a really good understanding and awareness of what each other do. It's no use that you've got a social prescribing link worker in a GP practice, but nobody knows what they're doing and the patients don't know they're there. The same for physio, so the help you can get in pharmacies, etc., etc. You need to know your neighbourhood as a professional as well, so that you can work in partnership to support people through that journey, not at standalone points in that journey, but together. And that leads me to the last one. We need to have a wide range of activities that people can go to, that they want to go to keep them healthy and happy. But we need to fund that. So those activities, they're not just run on blue air or fairy dust. We need to put some monies into it. And those activities, I'm talking about singing and dancing for children and young people as well, to support around their diabetes or their asthma. They don't want to go to a junior gym program in the gym. We need to support the adults with singing for lung health. Rock and roll or opera, whatever they want to be into, we need to make sure we got those opportunities there. 2 more points is, we need training to enable that to happen. We need to support the voluntary sector to step into the health field and have the tools and knowledge to do that and feel confident in doing it. But we need to train our professionals in the statutory system to understand the benefits of what we're talking about today. And we need to all be champions to really push that. And then we need to really, really get behind that in our long-term health conditions pathways. We've got creative health activities embedded there, not just pulmonary rehab, for example, or cardio rehab. We need to have the supporting roles of a social prescribing link worker, so they're there from the beginning, from diagnose till the life ends. So again, we see that partnership running through.
Thank you very much. And last but no means least, we've got Giles Wilmore, who's the Director of Community at Manchester Camerata.
Hi everybody, thanks very much. So apparently I talk too much and I'm likely to overrun the 5 minutes and that might delay your lunch. So to get around this, I'm just going to talk really fast instead. So when I was approached 18 months ago to join Manchester Camerata, I thought, me, work for a classical music orchestra? No, that's a bit stuffy and elitist. I wouldn't want to get involved in that. But actually, what I found when I joined them is they're a weird and wacky and wonderful orchestra. Yes, they play traditional classical music, but they were the only orchestra ever to open the Pyramid stage at Glastonbury with nightclub music. You know, they play gospel music, they play Northern Soul. It's fantastic. But the real thing that got me hooked on Manchester Camerata is the mantra that what we do off the stage in the community is just as important as what we do on the stage. And so it's my real privilege to be responsible for community services at Manchester Camerata, having spent my whole career in the healthcare system, working with Charlotte and many other people here today, trying to really promote things like social prescribing and person-centred approaches and really drawing on the assets in our community organisations. So now I find myself responsible for community services within a charity. And it's a real challenge, and I can see this from both sides of the system. But before I talk a little bit about that, hopefully we've got a short 2-minute film. We were lucky enough to be on the TV, BBC Northwest News, would you believe it, demonstrating one of our music cafes in Salford that we run with the wonderful Age UK over there. So hopefully that'll come up in a minute. But if it doesn't, we'll mime it together on stage. What happens? Oh no, it's here now. You're saved. Thank you.
Now, weekly music cafes for people living with dementia are being introduced across Greater Manchester. We reported on this project. It's being run by the Manchester Camerata a few months ago. Well, now its Music in Mind programme is being enjoyed across all 10 boroughs. It's run by professional musicians and volunteers, and it encourages people who are living with dementia and their carers to socialise. Isabel Fry has been to take a look.
Singing, dancing, percussion, everything you'd expect from a music cafe. However, there's a slight difference to this one. It's supporting people living with dementia and their carers.
She'd just be sleeping or, watching telly, whereas this, it gets the brain going, and yeah, they're just amazing.
Sometimes you can feel isolated, so being with a group like this, it will be beneficial for both of you now. So it's really a lifeline.
Volunteers and local charities are working with the Manchester Camerata team to bring the sessions to life.
It makes a really big difference. I think it's really important to create an environment where those affected by dementia can come together and be, connect with each other and really support each other. And for the carers to see that as well and really see that communication and that connection. Yeah, it's vital.
It's hoped the funding will go towards helping over 1,000 people living with dementia in Greater Manchester, as well as training up 300 volunteers to run their very own music cafes just like this one. Professional musicians from the Camerata lead the sessions, and in the future they hope to see music as a permanent part of dementia care.
So thank you. I hope that speaks for itself, and we're fortunate enough to be able to launch this with a range of partners across Greater Manchester because we've been funded by the National Academy of Social Prescribing, NHSGM and GMCA to be a centre of excellence for music and dementia. And the scale of the programme is quite significant. So that's one of the first 10 music cafes that we've opened across Greater Manchester in October. The plan is over the next year to get that to at least 40. So the idea is not quite every street corner, but as near as we can get to it, wherever you go in Greater Manchester, there will be a music cafe there to support people living with dementia and their carers. And we're doing this with the Alzheimer's Society, so some of the music cafes will be much more focused on their singing for the brain. Many of them will be looking at that methodology we use, where we really invite people to participate with us. It's not about performing at them, it's about them leading and creating their own music and being empowered. The programme also includes research. We've got a 10-year partnership with Manchester University, and Luke Munford, who's talking later on, is going to be leading our research programme, particularly this time to look at the cost-benefit analysis analysis of this. How do we make a business case to health and care funders that they should be commissioning this type of programme as a long-term support for people with dementia? There's also a national network where we're linking up organisations around the country working on similar projects. But just to finish, I was asked to reflect on the challenges of trying to run a programme like this and to make it scalable and sustainable. And I summarise them with 3 C's, which are the culture, the capacity, and the commissioning system. The culture, for all we have wonderful political support. We heard the Deputy Mayor, Kate Green, talking earlier. Andy Burnham came to our launch. There's a huge amount of political support. Many health and local government leaders really get this now, which is fantastic. It's moved a long way in the last 10 years. But for all that, I have to say there are still the naysayers in the system. They're usually hiding in the permafrost of middle management. They're stressed and harassed people with not enough money and an overwhelming waiting list and services that are under the pressure and short-staffed. And we're saying to them, never mind all that, come and work with us on all these creative, wonderful arts projects that they just see as a little bit fluffy, a little bit nice to have if you've got capacity and time. These people are not the enemy, but they are the people managing health and care services on the ground. And by definition, the ones who don't get it wouldn't be here today because they don't get it. And if they were here, they wouldn't have engaged in dancing like a tree, I can tell you that for nothing. So you've got to build the relationships. You've got to get into those local healthcare organisations, those local services, social care, local government as well, and build the relationships and explain to them what we do. But that's quite hard because of the second C, the capacity. We're a small team. There are 3 of us working part-time trying to roll this out across 10 boroughs with 15 partner organisations. To manage all those relationships is quite difficult for us, but it's also difficult for them. As I say, they're hard-pressed, they're short-staffed, they're overworked. So you've got to allow time to build those relationships. They're unlikely to invest time or energy in a service that they don't really know or understand, however brilliant it is. And the final one for me, commissioning. As I say, we're fortunate we have a 3-year funding grant for this programme, which means we can really set up something at scale that will hopefully sustain. But it is still a non-recurrent one-off grant. What the Holy Grail would be is, are we a commissioned service year in, year out, alongside all other health and care clinical services? Is the value seen to be equivalent? And therefore we can plan not just for 3 years, but for 5 years, for 10 years, that this service will be here in the future. And despite all the publicity and the enthusiasm and the political support, it won't just drift away when cost pressures come in a few years' time, as inevitably they will. So I hope that doesn't sound too negative, but I want to be honest about those challenges. To finish, I am optimistic. We are overcoming them. We can overcome them, but it does take time, energy, and commitment. Thank you.
Thank you very much. So we've got about 10 minutes to open the floor to any questions that you might have or further information from the panel. Have we got a mic runner, or shall I do it? Oh, thanks.
Thank you. Thanks. There's a little bit of slapstick going on there. Thank you. That was so interesting. Thanks to all the speakers. There's so much information there. I've been writing down notes frantically. So my question would be to you. Sorry, I didn't catch what your name was.
Giles.
Giles. Hi. I was just wondering. You said that you're going to be rolling this out on a much larger scale. How do you propose to choose the organisations and places that you'll be working with in future?
We've already identified a range of partner organisations which we're working with now. These are all local charities based in the community, so different branches of Age UK, Mind, dementia-specific charities. The criteria mainly for us was they had local presence in the different boroughs and they also had expertise in supporting people with dementia. If I'm honest, the process for choosing them was very chaotic because the grant process only allowed us a month to go from expression of interest to full final bid, and therefore you don't have time to run any kind of fair application process. You just basically email and ring people up like mad and say, are you interested in working with us on this? Can we put your name on an application? You know, so it's not as transparent as we would like. Going going forward, of course, what we're trying to do is build a network of those organisations through the Learning Network part of the programme, so that we're much more aware, not just in Greater Manchester, but this is a national centre of excellence of who is out there working on music and dementia that we can partner with and we can share learning with and might be a collaborative partner in the future. So we can certainly, through, I think, Julie and the organisers share details, but it's musicinmind.org. Please look us up online or come and chat to me afterwards if you're interested in being involved.
I will do, thank you.
Great, thanks. Thank you.
Hi, I've got a suggestion to make, and it links to what Charlotte was talking about, really. I have chronic health conditions, but of course I do know how to artistically medicate, as a previous speaker said. And I quite understand why GM Creative Health is looking at trusted providers. I completely understand that. But actually, that doesn't work for the vast majority of people in Greater Manchester. A few trusted providers is never going to do it. And I wonder whether in the longer term, you might have a scheme of what you might call creative health supporters, who would be much smaller organisations who are embedded in neighbourhoods, who are never going to go through the process of being a trusted provider, but would be willing to do a small amount of training or awareness raising or whatever in order to say and have a badge that says, I'm a creative health supporter. So it's just a thought, and it really links to what you were saying, Charlotte, because I don't see how we're going to get scale if what we're looking at is, with all due respect, organisations that I love, like Manchester Camerata, they will not be able to deliver those things at scale across the whole of Greater Manchester, much though I love them. Okay.
Thank you.
Can I come back on that? So you're absolutely right. And I also don't believe that everybody needs to access activities that's delivered by health or commissioned by health. So I think it's all to do with our activation levels, and our health literacy, how much we are able to understand what will improve our health. And if I got told I had diabetes, I would have a pretty good understanding of what that means. I would Google it and I would hopefully do what I needed to do. I would still ask a friend if they wanted to go with me to this new activity, because it's nice to go to, isn't it? So, but I think it's important that we have it embedded in the health services for those that wouldn't necessarily do that, so they are really truly supported through that journey. So that's the difference, isn't it, between individuals and their challenges.
Yeah, thanks, Terry. Just go in front, and then we'll come to you after. Paul.
That's quick. Hi, my name's Lucy Robertshaw. I work for Darts. We're a large participatory arts company in Doncaster. It was about the E&O programme. So since 2021, we've run a very similar program called Breathe and Connect, but as well as using singing, we're using movement. We're linking with the respiratory team at the hospital. It's face-to-face, 7-week blocks. This is our 3rd year. There is a question in here. We started off working with patients with long COVID for the first year. And then in the 2nd year, they wanted us to move to breathing pattern disorder, which we did very successfully. And now we're working with people who have COPD. And my question is, we've got evidence that we've reduced waiting times from 12 months to 4 to 6 weeks for patients. Patients are attending more regularly than they would do with normal physio sessions. But also we're then feeding into the other participatory arts programs that we do, so it's not a kind of an endpoint. But there's a real challenge where every single year we battle for that money, even though the respiratory team are absolutely convinced. So, we're at the stage now where we've only now been paid for the first 4 months of work, which should have been paid 4 months ago. And as a large organisation with great cash flow, that's fine for us. But for other organisations, that's real difficulty. And I don't see how we get that recurrent funding that you're talking about, because it feels like it's there, we've got the evidence, we've got the buy-in from the respiratory team. Do you have any advice on how you get it above and above and above in order to get buy-in for proper, 3 to 5 years worth of work? Big question, sorry.
Great question. And I don't have an answer. But what I will say is that we have to keep having the conversations, and we have to keep stating the benefits and the improved outcomes. And it's about communicating what happened, what you communicating those best practice that actually makes that real difference. Because I don't need to tell anybody in here that the NHS is so strapped, particularly in Greater Manchester, and the scrutiny on finances is the worst it's ever been. So I think what we can do is we can share across Greater Manchester the work that's happening in silos quite often, and it's about building those opportunities and those offers for patients into the pathways. Because if we can build them into the pathways and get the buy-in from the clinicians, and we've got the evidence to show that it works, we have a better chance of getting that funding. So I'm afraid I don't have an answer, but I would like to pick up with you just to learn a little bit more about what you're doing and where you're from and how you've linked in and done that.
Would love to do that, thank you.
Great, thank you.
Hi, sorry. I'm from E&O. I'm the head of Engage. So I'm just answering in place of Cassie because she's only been with us for 6 months and just works on E&O Breathe. So from a broader organisation perspective. So to date, we've not received any funding from the NHS for any of our programmes. So this project has purely been funded by our Arts Council programming and trusts and foundations and individual donations for the work that we do. I absolutely recognise that E&O are a large institution that can pull in that funding from other places, but we are not successfully doing what you're also struggling to successfully do, right? I think one of the opportunities, and sort of speaking into what Cassie talks about that right moment and the right framing, E&O moving to Greater Manchester is turning heads not in the creative health space, but in the broader political space around the Arts Council, around all of that, right? And I think that's what we see this as a huge opportunity for. The whole of the political world wants to see this succeed for many reasons that are much bigger than us as an institution, or indeed Greater Manchester as a location. And I think that E&O Breathe is one of the programmes that we want to put as one of our flagships. This is what E&O can do here. This is what that work can look like. And in the fact that more than just the people that get this work are looking, I wonder if that's an opportunity for us to use that evidence that we're equally trying to use to pull on to say it's really working. That might mean that people outside of the people that already are really passionate advocates for the work that all of us do might have something to say. That's my hope.
Sure, Paul from Mobile Mortals. Yeah, my question was going to be about recruitment of people with long-term health conditions, and particularly those who don't recognise the arts as a vehicle to improve their health and well-being. From my experience, working with underrepresented communities, people don't necessarily recognise that as a way, and to sort of build up trust takes a lot of time and effort and resource in order for people to even give that kind of thing a go. Once they do, they often react positively. So if anyone's got any reflections on tips or approaches to reaching out to communities who don't necessarily recognise the arts as a way to improve their health, I'd like to hear that, and working with link workers to sort of improve how they can advocate for the arts as a vehicle to do that.
Hi Paul, it's good to see you again. I think for me, my experience in this particular programme is it's fairly obvious, but you've got to go to where the people are. So what we found with the music cafes like that one in the video at the Chandos Social Club in Salford, they already have a group that Age UK facilitate. We went to them, we brought the service, we said, would you like to engage in this? And actually what we tend to find is once people engage, they love it. But you don't know what you don't know, do you? So you've got to give people the opportunity, and that means find where they are. In some of the other boroughs, if I'm honest, we're struggling more because what we've tried to do is go into those traditionally hard-to-reach communities where there aren't the services available. They're not hard to reach, we know where they are, but the challenge is then you've got to build that relationship. So, for example, we're working with the South Asian group in Oldham, and we've got some wonderful volunteers from that community who are learning how to facilitate the sessions. And they're actually the ones then going out and advocating in their community to bring people in, because I don't have the roots and networks and contacts in that community. And that's taking more time because we've got to build up relationships. So that one's been a bit more of a slow burn. But if we didn't do that, we'd only ever end up going to where people are already getting some kind of support and giving them a bit more support. So it is about those partnerships and about the relationships, and just recognising it takes time to build those up, which for us is why this is important. It's a 3-year programme. If this is a 1-year grant, you wouldn't have time to do that and deliver and evaluate and show benefit all within a year.
I guess it's also making sure those people are resourced adequately as well. So if you are relying on, you know, community champions or whatever you want to call them, they need to be resourced and respected for what they're doing, which I'm sure you are doing, Giles, but I just wanted to make that point.
Thank you so much. I can see some other hands up, and I'm so sorry. I've been given very strict instructions. There's a very short lunch break, so it is now 1 p.m. I encourage you to keep the conversations going after this.
So just 1 second to come back on my colleague's question there and Giles's response. So there's a role for local VC, FSE. It's a hard one for me to say that one, but there's a role for the infrastructure organisations across the 10 boroughs that can help support groups like the Camerata, ENO, the smaller groups, the micro groups, in engaging with their communities. And I think we're failing to recognise that today.
Yeah, I think that's a really good point. I know CART will work with a lot of voluntary sector organisations. Thank you ever so much. Let's give a big round of applause to our fantastic panel, and thank you all ever so much.